going to the dentist and how one dentist is now using a therapy dog to ease stress for young patients. That's happening in Queensland. But the fact is, there it is, how gorgeous. You might not go to the dentist for your teeth at all these days, with some now offering Botox and other cosmetic injectables. To find out more, we have dentist Dr. Christina Kane with us. Welcome to the show. So are people happy to be injected with Botox but scared of the drill? Is that how it works?
Well, it's all about motivation really, Sarah, isn't it? I mean, who here actually would like to go to the dentist regularly? Most motivation is, you know, you've got pain or you've got something broken, whereas how nice is it if you can go to the dentist, have some treatment and then finish up with some injectable treatment so you come out actually with a bit of a spring in your step, feeling a bit better about yourself.
Wow.
Makes quite a difference.
Are there... Can Botox actually help your teeth and help your jaw in any way?
Absolutely. So a lot of people in society at the moment get quite stressed out, so they clench a lot, so you can get quite a bit of pain in your jaw. Sarah?
You were diagnosing me through the telly, weren't you?
Right,
So I've got these, and I thought... are they mandibles? Is that what you call them?
Masseters.
Masseters.
Yes.
So basically it's a build-up of grinding in your
That's
spleen.
right. So that big muscle which extends from your cheekbone down into your mandible actually causes you to clench. And if it's overactive, like any muscles in our body, you can get some muscle spasms and that can give you headaches and cause you to grind your teeth. And then you have further impacts by the jaw actually becoming quite tender and a bit clicky.
Yes.
As well.
So what can Botox do?
So what it can actually do is it can actually relax that big muscle. And there's actually another really big one up here too called the temporalis muscle. So if we can relax those, not to stop you from actually being able to eat and speak,
and talk,
obviously, that actually takes a lot of the pain away. But it's a multifaceted approach. It's just not a one-stop shop, but it can certainly help.
And I was reading also about asymmetrical smiles. You can do something for that.
Oh, it's actually quite amazing what you can do with that, John, because some people can be born with a little bit of a paralysis, say in a muscle down here, which pulls down when you smile. And then if you actually need to correct it and make it a bit more symmetrical, you can actually relax the muscle on the other side so that it actually brings it up and makes it more even. But there are other things as well, like gummy smiles.
I think we just saw a picture of that.
Fantastic.
Great. That's the after shot, isn't it?
That's exactly right. So that just involves having a little bit of Botox in here and in here on either side.
Under
Very
the nose.
quick. And it stops pulling up that lip, so you can get some great results.
What do you make of, because some people might be questioning the ethics of perhaps a dentist offering these cosmetic procedures to indulge our vanity?
Yes, sure. Well, you've got to remember dentists are actually a very conservative bunch, believe it or not, and we have a lot of very strong ethics. We have to, it's all about patient care. So we have a wonderful regulating board, including APRA and the dental board. There are great courses which dentists can actually attend, namely ADFA, Australasian Academy of Dentofacial Aesthetics. They have full training and support there. You've got to remember, dentists are great injectors. We love injecting. We love...
You guys are evil.
The biggest needles. That needle that goes in for anaesthetic is huge.
Yeah. I like the little needle you get to prepare you for the big needle.
That's right. They can look fairly dramatic.
And also, let's call a spade a spade. I mean, a lot of dental work is cosmetic anyway. I mean, you get braces to straighten your teeth or you get your teeth whitened.
Exactly.
That's cosmetic.
My dentist actually won't whiten teeth.
Right,
because he says it's... He says, and I know of no, but he says there are carcinogens in the stuff.
Yes, well, in the end, we're not going to get anything through the TGA unless we can actually apply it to our patients. You know, it's just one of those things you have to investigate, get lots of opinions. I'm all for, you know, bringing in different ideas and concepts, and but you know what works, and you have to get through the TGA first.
And what's the most common time for people to visit the dentist? Is it 2:30?
Oh, my God. 2:30.
I've never heard that one before, Jo.
That's terrible. You are awful. Can you stick a needle in his face just for fun?
I think he needs some antibiotics
I just
today.
want to feel something.
It's interesting though, because we are seeing these pop-up injectables places where you can, in your lunch hour, duck in and pay $99 to have your lips plumped up and that type of thing. But it does make me feel a lot better knowing that, I mean, you guys are well versed in the
training you've had.
That's right. And we do know anatomy, we know how the face actually works, and we are very aesthetically driven. We're Bob the Builders. You know, we just love to fix things and make
And
things
if you
look really
are
good.
getting Botox therapeutically, as in to correct jaw issues and so forth, can you claim any of that back?
I'm not at this stage currently. That is another fight that we continue to really address to make it work out for everybody a little bit more financially.
You guys aren't cheap.
No,
I'm
well,
just
we're
saying that
not.
in a really loving, caring
and
way.
frankly, anything injectables, they're not cheap either, but it's about the feeling that you get as a result of, having a little bit of enhancement here and there.
What if you need to get it so you can look beautiful on television? That's a genuine... Oh, they're not even going to try to... That's how ugly I am. That's how horrible I am.
I think they answered with that directing right there, that vision switching.
Yes.
It's been fascinating talking to
Great,
you.
thank you.
Dr. Christina Kane, thanks so much for
Great,
joining us.
thank you all for having me.